Okay, you have the floor.
Okay, are we going live?
Yeah, live.
Okay, good evening, everyone. And thank you so much for joining us this evening for this special first meeting about hair loss and skincare. My name is Elsa Crosby. I am your educator moderator for this evening's event, and I have some extra special people with me. So what I'm going to ask each person to do, we're going to start with Mike, and then go from Mike to Melody, and then Melody to Sherry, and then our doctor of the hour, Dr. Dika. So if you guys could say your name, the name of your salon, and your area of specialty.
Hi, my name is Michael Hurst. I live in Milwaukee, Wisconsin. Strands Beauty Salon. My is in natural color and cuts.
Thank you. Melody?
Hi, you guys. My name is Melody Brown. I'm the owner of Amani Natural. I specialize in natural hair care. I'm in Milwaukee, Wisconsin.
Thank you so much. And Sherry?
Hi, I'm Sherry Douglas. I am the owner of Hair Chemistry located in Brookfield, Wisconsin. I also do natural hair and health care of your hair.
And finally, Dr. Dika.
Hello, well, thank you everybody for joining us. And by the way, Melody is my hairdresser and she's been doing my hair for what, 7 years now?
Yes.
So we go a long way. So I'm Dr. Dika. I am currently in Burlington. I opened my practice, a month ago? And you can see the sign back there. So that's where I am right now. So I'm a dermatologist. I've been practicing for over 2 years now. And I love, hair loss, especially skin of color or dark Black people. We have a special type of hair loss that, is not commonly known, or some people don't know how to kind of diagnose or treat it. So that's one of my passions, in addition to everything skin, hair, or nails. Thank you.
So thank you so much, Dr. Dika. I think I would like to start with the hair loss component. We'll come back to the skin a little bit later in our presentation. So my question to you as stylists is, what are some of the things that you see when you see clients, when they come to you? Because we're doing this presentation about hair loss. So what are some of the things that you have seen when you see your clients, when they sit down in your chair? And any of you can pop in when you're ready.
Well, I've been doing hair for 30 years, and I have seen a lot of hair loss around the edges, pretty much all the top of the hair. I mean the head, and it's pretty bad. I've seen some come back. Some of the hair have came back, and some have not came back. So I've seen that, and it's very disturbing to see that. And when you find that, can you grow it back? You know what I'm saying? And so it's kind of hard when you are putting stuff on there to damage even more. So this is a blessing for me to learn more about what I can tell. So that's pretty much.
Okay, Sherry, what are some of the things that you've noticed with clients?
What I've noticed also, like Michael said, is the circular pattern at the top. The edges are going on the sides. Sometimes something going on in the background. They're wondering what they can do. A lot of them have, somebody actually told me, I have an issue right now with it. She's going to be a new client. And she said, maybe some crochet braids. I said, absolutely not. You will not be putting any crochets into your hair as you have balding going on, because that's going to cause it to be, now it's going to be traction alopecia. And now you got a whole new problem. So what we try to do is stop the problem, what's going on. A lot of things I tell people is things could be happening on the inside of your body that be making this all going away. Weaves could be doing this thing. Everybody's hair is not strong enough for weaves. Sometimes weaves are improperly installed, or
So
they're not taking care of them like they're supposed to.
So you mean your cousin and your neighbor is doing your hair instead of a professional? Is that what you're saying?
Professional. Yes, having it sewn in their head and then having it sit there for 6 and 7 months, and then they're not getting it washed, and then they sit there like a cradle cap. Now you want somebody to fix it and figure out what's going on.
Cradle cap. Okay, I haven't heard the term of cradle cap since a newborn baby. Melody, what are you noticing with your clients?
Pretty much what the two stylists have stated, pretty much the same thing, just the tension. One of the things that I notice is I have a lot of older clients, and the medication that they take definitely cause their hair to change, not only just the hair, but their scalp, receding, balding. Like I said, alopecia is very fragile. And one of the things that I learned is honesty is key as a stylist. Making sure you're just not doing a style just to please your client, but talking through, discussing, consultations. What is your texture? You know, is your hair strong enough? For even if you have healthy hair, doesn't mean that you are compatible with a style, you know. So just making sure you're doing a full consultation will prevent that balding, and to, like I said, be honest. But yeah, pretty much what they said, just all around, from hairstyles and everything.
All right, Doc, you have your hands full. I'm going to ask you a series of questions just based on the things that I heard the stylist mention. And if you could just give us your medical expertise, that would greatly be appreciated. So doctor, I'm just wondering what types of things are happening, or what types of hairstyles create alopecia, or this pattern baldness, or the baldness that we see, and what is that called?
Well, thank you. So based on what each one of the hairstylists discussed, the different type of hair loss that they talked about, right? Sherry mentioned, the traction from, tight braids and things like that. And then Melody mentioned, the hair falling out because of the medication, right? And we talked about the balding. So alopecia is a big umbrella of hair loss. So you have hair loss that is non-scarring, or something where the hair can grow back. And you have what we call scarring hair loss. So your hair goes away, you lose like the hair follicle, and the hair cannot come back. The traction, the hair shedding from the medication, those are more like what we call non-scarring. So meaning most of the time the hair comes back. But even with traction, the more traction you put on the hair shaft, you might destroy that hair follicle. So the traction that people get here, eventually it can become scarring. So where it doesn't come back.
So are you saying if someone gets, like when we were younger, they straightened our hair, are you saying that could create some form of alopecia?
Well, the chemical can damage the hair shaft, right? The texture of your hair, right? But the hair follicle itself, the more you pull, right, you're kind of creating some tension and kind of inflammation under the skin. And then the more you do that, then that area is going to scar down, just like keloid, right? There's nothing that can grow into a keloid. So once it's scarred down, you can't have hair growing there. So those are all non-scarring. But what the bald spot that Sherry was mentioning is a very common hair loss in Black. So it's called centrifugal cicatricial alopecia, or we kind of call it short for CCCA. It starts, you don't even know what that is starting. I have a friend who had her hair was just falling off in residency when she was kind of stressed out, and it will be itchy, and then later it will grow back. So she never had like a bald spot. So for her, for instance, it was difficult to diagnose. It took like 2 years for somebody to say, this is what you have. So that's the main thing, right? You want to make sure you diagnose it, because the longer you go with the inflammation, meaning inflammation means anything that's itchy, when your hair is clean, washed, it shouldn't be itchy, right? Anything that is tender, burning, some people they can say my scalp is hot for no reason. It's painful. It's not normal unless you have something going on.
So it's not always dandruff?
No, it's not always dandruff, right? So if your scalp or your hairstylist is doing your hair and then she doesn't notice any flaking or any, sign of dandruff, but you have those symptoms. So they're coming from somewhere, right? So they're not on the skin. You can't notice it on the skin, but under the skin, there's probably inflammation.
So like Sherry said, the hair loss could be internal.
And genetic, actually.
Oh, genetic. So if it's genetic, that may mean that the mother or even the father can pass that on to their children?
Yes. So the CCCA is more common in female. I would say 90% or even more is more female that have it. But they've over the years they're doing more studies because initially they used to call it hot comb alopecia, right? They thought it was from the hair styling, right? Using the heat and all that. But then they noticed that even people that are all natural, they're still having that type of hair loss. So now we're doing more studies and they found a gene, right? The gene is kind of helping with the folding of the protein that makes the hair follicle. So in some people, mostly Black people, that gene is abnormal. So then your body is like, this is not a normal hair follicle. So it wants to get rid of that hair follicle because it's not normal. So that's when the inflammation comes in, and that's how you kind of start losing your hair because your body is trying to get rid of that hair because it's not normally formed.
Wow.
Wow.
So as stylists, have you seen that? Have you experienced clients that have the swelling, the itching, or the burning? And what did you do before you knew about it being internal? What types of suggestions did you give before you had this working knowledge? Or what types of things are your clients saying to you?
So I would say for me, one of the main things my clients come and they want me to scrape their dandruff, lift their dandruff up. So that's something that a lot of our mothers and grandmothers have done over the years. And you think that is helping. And, you know, you do it. And one of the things that I noticed that my clients' hair, it didn't improve it. It helped for that session. It didn't improve it. And also it caused that inflammation because we're aggravating that scalp. Also, one of the other things that I noticed is during the shampoo, they're saying that because I'm using the base of my fingertips, it's not good enough. They want me to go in with, you know, my nails because their scalp is itching. And you know, you think that that's okay until you learn that that's not helping. It's causing, you know, sores, and it's causing more hair loss because I always say it's like your follicles are dying. That's why you feel those little, you feel like ants or something crawling on your scalp.
Well, I normally I would use like dry and itchy dandruff shampoo, you know, to try to help them out or whatever. But knowledge that I'm getting tonight, never know that it can be, you know, information up on the scalp or whatever. But that's what I pretty much have done, you know, and like I said, it helped them just for that service. But when they come back, you know, they still got the same, you know, the same problem, you know. And so now I know the information, what I could, you know, pass on to them, let them know, you know, you need a dermatologist because, you know, it's something else going on.
Yeah.
So, you know, it's a lot now. I mean, I'm learning a lot about it, you know, and I've seen this over 30 years, you know, since I've been in this field. And some of my scalp is so tender, you know, and I would, you know, like pretty much massage the scalp, you know, try to get the blood to flow, you know, and like I said, it helped, you know, just for that time. But then when they come back, the same thing. So it's like a repeating, you know what I'm saying? Ongoing.
Pattern.
Yeah, it's a pattern. It's an ongoing thing. So now I know, you know, I have not. So.
Okay, Dr. Dika, did you want to comment about that?
Yes. So I wanted to say, sorry. So I wanted to say anything that causes inflammation on the scalp, right, on the hair is not good, right? Dandruff is another one. Dandruff in long term, if you have dandruff that you're not treating, meaning dandruff is a medical condition, right? It's called seborrheic dermatitis, where we usually prescribe not only the shampoo, sometimes topical steroid, and then sometimes we even give pills, right? Antifungal pill or anti-yeast, right? Because dandruff is due to a yeast that is causing the oiliness and the greasiness and the scaling, right?
Gotcha.
If you leave that untreated, over time, that can lead to hair loss. Psoriasis can lead to hair loss, right? Lupus can lead to hair loss, right? Infection like ringworm or tinea can lead to hair loss, or syphilis. So all those things that can cause inflammation on the scalp can cause hair loss.
So greasing the scalp is not the solution, huh?
No, it helps.
No.
Like Mike said, right? It helps, but it doesn't take care of the problem, right? So if you have inflammation, yeah, go get your hair washed and everything, but make sure that you get a diagnosis so you know what it is. Then you know first how to treat it and how to manage your hair moving forward or your scalp moving forward.
Dr. Dika, I have a question. Sherry, you can go ahead and comment, then I'll ask.
Well, I'm a product of cerebral dermatitis, so I know the drill about all that, from the face to the scalp to the back. I went through it through middle school all the way to high school, probably partially of college, and it was horrible because nobody knew what was going on. Being a person of color, I had somebody that wasn't a person of color, and he was an older dermatologist, and he told me to put some gel on my scalp. I don't know where he got that from. Gel. Putting gel on my scalp. Then I had the tar. I'm sure you know about that, Dr. Dika, the tar, walking around smelling like tar. When dry and itchy scalp came out, then okay, yay, that worked for a second or whatever. So I really had to figure out for me to work on my scalp. So really now it's like natural oils or something. I know he said no oils, but it works for me.
Yeah.
You know what I'm saying? So
no, I'm not saying that oils don't work, right? But sometimes, you probably need more than that, or the oil is going to calm down the symptoms, but it's not going to address that, inflammation. Yeah.
Okay.
So my question to you, Dr. Dika, is what type of treatment, if someone is experiencing the CCCA, which you said, which was a circular pattern of hair loss on the top of their head, or if they're experiencing alopecia, or due to different hairstyles, what type of treatment would you customarily give them? So if they come in the office, what would happen? Because a lot of people will want to know.
Thank you. So again, for CCCA, usually the thing is, we always say, well, one of my colleagues, she quotes somebody else, that time is follicle, right? So the longer you wait, the more follicle you can lose. And then once you lose those follicles, you don't get them back, right? So we want that early diagnosis enough that we can save the follicles, even though you haven't some inflammation, but you haven't lost your hair follicle, right? So as long as you still have the follicles there, eventually once we've calmed down the inflammation, we can make that hair grow. So when I see you initially and I make the diagnosis, my goal for the first 6 months is to calm down the inflammation. So usually we do a combination treatment. We're going to do injections of steroid, topical steroid, oral antibiotics. And then while you're doing that, also sometimes we also add even supplement, right? Rogaine doesn't hurt. The supplement called Nutrafol or Viviscal, some natural kind of supplement that helps stimulate the hair to grow.
You mentioned the hair follicle. How do you know if your hair follicle is dead? Does it look a certain way?
Well, yeah, for me, I use this special thing, right? So even without it, I can tell if there's any opening there. So, but when I look under here, if I don't see any opening, we call it ostia, the opening where the hair grows out of. That means that hair follicle is closed. So you have a scarring there. So when you come in, I look on your scalp with my light, I can see the ones that are already closed versus the ones that are still open, right? So we want to focus on those ones that are open, but they're kind of almost going away, right? We want to make sure that we rescue them or revive them.
Now I know from, and I'll be honest with you guys, I am a patient of Dr. Dika's, and I have seen dramatic changes and dramatic care to my hair. I was getting lots of perms and colors. And Dr. Dika, could you just mention what happens when you put a lot of perms and colors, or if you put weaves and glue in your hair, what happens to your hair?
So glue and weaves, right? You're traumatizing not only the hair shaft, which is the hair itself, the strand, but the follicle, where it's coming out, right? So by doing that, not only your hair is gonna be fragile, so breaking off all the time, right? So it's like my hair is breaking. I don't know why. That's because we're doing all those chemical. When we use chemical, we relax our hair. We're changing the bond of the hair, or the chemical bond that holds the hair together. So the hair is always splitting. Your hair is always splitting, or you feel like your ends are kind of all thinned out and all that. And again, all those chemical or kind of how do you call when you're coloring your hair, you don't know, right? Sometimes people get a reaction or dermatitis to that.
So what about the person that wears a wig? What about that?
So wig is okay as long as you use something that protects also your edges, right? Because you're letting that sit on the side on all yours, around your hair itself. So if you have it sit first of all for too long or sleep in your wig,
Right.
that's not a good thing, right?
Right.
First of all, make
Mhm.
sure that you remove it when you can.
Right.
And then also if you can have something, I'm sure the hairstylist would probably know better than me, that will kind of protect that hair from all that friction or traction just from the, the wig moving around or something like that.
Would any of the stylists like to comment about that? Because I know a lot of people just resort to, instead of getting the treatment internally, like you mentioned, Dr. Dika, they'll just wear a wig and that will resolve their issue. So would any stylist like to comment on that?
I'll comment on it because I tell my clients that all the time. It's okay to wear wigs, braids. Look at me, I got braids on and all those things. It's okay, but give it a break. Like I tell my client, if you are wearing your wigs, come in here so I can treat your hair, girl. Don't forget that you have hair that God has given you growing from your scalp. That's your natural hair. Keep up with that because you don't want to look up and it's gone, because there's so many Black women out here that are, their edges are gone. They like, oh my God, my hair is missing and stuff, because you've been sleeping in these wigs. You've been doing these braids for like since you were 9 and your mama didn't, tell you anything any different, because there is. There's so many women that my mama just put braids in my hair because I didn't know. Give your hair a break, give it some treatment. Embrace your hair. It's okay, because so many women out here do not want to embrace their hair because they're so addicted to those wigs and those weaves and all that type of stuff, because it's so easy out here for them and they don't know. And then they get their hair and they're like, I don't like my hair. That's because you're not giving it a time out process. It's a process. You have to get into it. It's just like anything else that you do out here in life. You have to get used to your hair. Once you get used to your hair, you'll love your hair when it gets used to you doing it. So just give it a break, did treatments, put your little wig on, hey girl, and all that, but just give it a break sometimes. That's all.
Sherry, I know I heard you mention in an earlier conversation about your hair being like the soil. Could you comment on that?
Oh, I always tell people that your scalp is like soil and your hair is like a tree. You have to feed it. You have to water it. You have to make sure that it is being treated as such. If you don't, it will die and it will break off and you will be crying. So treat your hair, love your hair. Ladies and gentlemen, love your hair. It's okay to love your hair.
So, Dr. Dika, any suggestions on where do they start? Where do you start? Okay. I know for me personally, I was experiencing hair loss at a rapid pace. And now my hair I'm natural. Yay, I'm embracing the natural me. And I love it because it's easier for me to maintain it. And I don't have to worry about the damage that comes from chemicals as well as color. I do miss it. And I know over time, as my hair gets stronger, I'll be able to do something about it, or I may not. It's like learning all over again, because, from childhood, there was straightening of the hair. And then as you got older, you thought your hair was supposed to stay straight. So you got the perms and the relaxers or the things to maintain that same look. But I'm so glad. Thank you, Dr. Dika. And thank you, Sherry, who is my personal stylist, and Mike, who has also contributed, to making my hair a healthier. It's gotten a lot healthier from you all sowing those seeds. So, Dr. Dika, where do clients start? Where do they start?
Well, like I said, right, don't ignore the signs or the symptoms, right? If you know that, hey, you just wash your hair or something, but for some reason it's burning, it's itching, it's tender, that is a sign that there's something going on. At least now, hopefully we have some hairstylists, especially in the Milwaukee area, that know or understand these things. And then if they see a patient, the client tells them that, it's like, okay, there's probably something wrong, right? You need to have it examined by a dermatologist or a doctor or somebody that knows, so you can get a diagnosis. Once we get a diagnosis, then we can get a plan, right? As a hairstylist, you know how to wash their hair, but if without a diagnosis, you wouldn't know how to treat or what you're treating. So the main thing is to get that diagnosis. Once you have a diagnosis, then you can, we can go ahead and, have a plan. Actually, I have a personal friend, the one that I was just telling you that it took her maybe a couple of years to get a diagnosis. she told me that I just spoke to her 2 weeks ago. She went to a dermatologist. She gave up basically because she was on antibiotic and she was getting the shot. She only got the shot twice. And then her dermatologist told her, you're going to lose your hair. Basically, there's no hope kind of thing. She was like, okay, what's the point of me taking this antibiotic or getting these shots if, you know, it's not going to help, right? Versus telling her that, hey, even though this is a scarring disease, if we calm things down, if we maintain, you're probably not going to lose your hair, right? She told me when she was taking the antibiotic and doing the shots, it wasn't itchy. The itch went away. But the minute she stopped, the symptoms came back. So just trusting or hopefully having a good hairdresser that was going to tell you the truth, like Melody said, and then refer you to get that diagnosis, and then be there to help you taking care of your hair.
So how frequently would you say, Dr. Dika, a person should go see a specialist such as Melody or Michael or Sherry to get their hair done? How frequently should they go? So should they go every week, every 2 weeks, or does it depend on the individual?
I would say at least go one time to that person that you know that has that experience, right? They're going to do a consultation, just like Melody said, right? A couple of my colleagues, actually, they have a hairstylist in their office. So when they see a patient, they're like, okay, you have to see the hairstylist at least like 3 times. So she shows you what you're supposed to be doing. What are the safe things to do on your hair? So that even if you decide that you don't want to continue with her, you're going to go with somebody else. You can, at least you have the knowledge, right?
I'm so glad you have these 4 stylists on your team, or 3 stylists on your team that can help everyone in the Milwaukee area. And I think I speak for so many people, Dr. Dika, when I say, where have you been? So many people have been looking for you, you know. You know, a lot of people, I've heard stories of people that have gone to dermatologists for either skin care or hair care and not getting the appropriate treatment because of it being African-American skin. So we are so excited that you are finally here. And Dr. Dika's office is in Burlington, and it's not that far away. It's actually about 30 minutes from Milwaukee, but Mike, you always say something. What's that you tell everyone?
Well, you know, you can just drive and, you know, relax your mind. So when you get there, you know the questions to ask the doctor, and your mind will be programmed to say what it is really going on with your hair. So it pretty much, you know, relaxes your mind.
And I've heard you say before, people will pay for what they really want, right?
Yeah, people will. Yeah, if they want it bad enough, they will pay for it. You know, my great grandmother would always say, a person buy what they want and beg for what they need. So you have to invest in your own self. And if you want something different, you have to do something different in order to get it. So I don't think it's far. I just think this is something to clear your mind, get you there. And when you get there, your mind and your body is relaxed to really focus on why you there. You know what I'm saying?
Exactly.
And we rush. And then when we get to the doctor office, we miss half the stuff that we want to ask the doctor. Right. But on the way back home, then we think about like, wow, you know, I forgot to ask her or him that. You know what I'm saying? So I look at drive, relaxes my mind to get me focused.
Dr. Dika, you wanted to comment on something?
Yeah, I wanted to say again, this type of hair loss or any type of hair loss that we discussed today, they're all medical conditions, right? So meaning insurance will cover the treatment. So when I say you have inflammation, you're not going to pay out of pocket for the shots. You're not going to pay out of pocket for the antibiotic or the topical steroid, right? So we build the insurance because this is a medical condition, right? Yeah. Once we've calmed down the inflammation, if you want to get the supplement, buy the supplement or get like the injection that we call PRP or platelet-rich plasma, which is like growth factors to help your hair grow. That's a different story, right? Insurance is not going to cover. But for the itching, the burning, the treatment is all medical. So covered by insurance. Yeah.
Oh, that's good.
Yeah.
Now, Dr. Dika, I don't know if I've heard you say it to me as your patient, but would you just mention what the scalp looks like? I know if you said something about the difference of it being shiny, what's going on with the follicles?
So when you have early stage of CCCA, probably some people you don't even notice, right? You just have like an area where you lost your hair, probably the hair grows back. But the longer you have that inflammation, the scalp becomes really like bald, shiny, right? I have my little book here, but this is somebody that has, I would say, early when we can actually rescue the follicles. You see that?
Mm-hmm.
So if you look closely, those hair follicles, there's a little bit of redness and sometimes more like white around in the bottom.
Mm-hmm.
So this one, I think if we treat it, we can actually rescue this one. Versus you see some people is bald, right? There's nothing. I had a patient who came in, she had a lot of hair around, so I didn't even know. So she had like a pony, like she tied like a ponytail, yeah. So then it's like, how can I help you? She's like, hair loss. I'm like, where? Then she removed it and the whole spot was gone, right? So those patients, I agree that they, the wig is an option, and then actually hair transplant, right? Because they've lost the follicle. So those ones, I can help calm down the inflammation, but at that point, I don't think I can help that hair grow back. But I can prevent the hair around it stay intact, right? Because it's called centrifugal. Centrifugal means it's growing outward, right? The hair loss is kind of going that way. So we want to prevent it from going that way. So if it's here, we want it to stay there. We don't want it to expand.
Okay.
So what I'll do is I'll do the injections here so that it doesn't expand. But
Okay.
if it's already kind of burnt out in the middle, once that inflammation is gone, hair transplant is an option, right? I had to send that lady to my colleague who does her hair transplant. And he said, even for that, he has to biopsy to make sure there's no inflammation before he can transplant. Otherwise, it's a waste, right? Because her body is going to reject it if there's inflammation there.
So basically you're saying treat it internally so that your hair follicles can grow.
You can save those hair follicles, right? Then your hair can grow. Because once you lose the hair follicle, we can do transplant or wear wigs. But as long as you still have the follicle there, we can make it better.
Now I know
so you don't want to wait until you lose the follicles.
I know it seems like we've been focusing on the women, but Michael, I know you have seen some males that have had this same issue.
Yes, I have.
Type of hair loss.
Yes. I mean, you're looking at one now. You're talking to one now. I had a whole head full of hair, and I began to start thinning, and then it went from thinning and went bald. So I had to end up, going, bald. And I truly miss my hair. You know what I'm saying? But now I'm learning different things that I may need to go back and do some research and try to find out, do I need, some hair implants? You know what I'm saying? Because I don't think that all my follicles is all, damaged. I really don't think so. But I see a lot of men, that having the same problem, the thinness, the baldness, you know what I'm saying? And they get frustrated, and they just go completely bald, like I do. And I have some friends, in other cities doing that. They call it a man weave. And I don't pretty much, I don't pretty much,
man weave.
I don't pretty much, promote it. But, some people feel that, okay, because I'm the hair follicle's gone or whatever, I might as well just put a man piece up there and keep my hair on the side and fade it in or whatever. I thought about it myself, you know what I'm saying? But then it would be like I was going against what I don't believe in. You know what I'm saying? As far as the lace front wigs for the women and stuff like that, because that glue can really damage the hair. You know what I'm saying? And it can cause a lot of different things going on. So yes, I see it a lot in men, and we talk like the women, and we do.
Yeah,
I think Yolanda has a question, Miss Elserida, I think.
Oh, okay. I'm so sorry. Okay. Welcome, Yolanda. You have a question?
Yeah, what about people who lose their hair as part of the aging process? Will this treatment be effective for them? Because I'm 61 and I'm losing hair in the top of my head. I mean, you can see my scalp.
You don't have your video on.
I know.
Okay. No, she will probably do that as a private.
Yeah, she can come in and we can take a look. Do I have the floor?
Yes.
Okay. So I'm not sure, is it up here that you're losing hair, or is it like the part line, or so
it's like in the wait, let me see if I can turn my video on. Okay, it's like right in here. And my hair is graying, and it was already fine and thin, but now it's like you can see my scalp, and I get these bumps, like these sore bumps in the top of my head.
Okay. So I don't know if the sore bumps is related to the hair loss that you're describing. I think you're describing what we call female pattern hair loss, which
Yes,
is more of like the hormonal, right? As we get older, for some reason, you have the male pattern hair loss, right? That Mike was just talking about, and then you have the female pattern hair loss. So usually that one, there's no inflammation. So usually you don't have any itching or anything. Your hair just becomes thinner, right? You still have the hair follicle, but the hair is like a fuzz, right? It becomes more thinner and thinner. So those ones, usually we don't treat for inflammation. So we don't do the injection of the steroid. We say, you know, you can get the supplement, you can do the Rogaine over the counter. The caveat with the Rogaine is it's a lifetime membership.
Yeah.
Meaning once you start using it, it's gonna get better, right? You're gonna have to keep using it, otherwise you regress back. The supplement, usually you don't see that, meaning you can start a supplement, and if you stop it, it's not like you're gonna lose everything. And then what we've been doing is injections of growth factors that I was talking about. One is called PRP, so platelet-rich plasma. We draw your blood, we spin it down, and we isolate the plasma or that has growth factors, and then we inject it back into your skin, your scalp, right? So that is going to help kind of nourish your hair follicle or stimulate your hair. Yeah, exactly, to grow a little bit thicker. So yeah, so that's something that we do now. We do, some people do actually laser, where the laser just open up the hair follicles, right? And then they squirt that growth factor and kind of rub it in. So the laser allows, it's almost like a sponge, so it can absorb the growth factor.
Okay.
So there are multiple options. The other one is I don't know if you've heard of Hydra Facial. So they have a piece for the scalp. It's called Keravive, where we not only cleans your scalp, but they also have growth factors serum where you can put it in that way. Yeah. So those treatments are more, they're not medical, meaning insurance is not going to cover, right? Because they're like, you don't have inflammation, so we're not going to pay for that treatment.
Okay.
But we've seen good results with those.
But her coming to have a visit with you just for you to give her a consultation.
Yeah, even for the bumps to see what they are.
Yeah.
Oh, that'll be covered. Okay.
Yeah.
Thank you so much, Yolanda. Okay, now okay, so Dr. Dika, I'm gonna ask you a question. Okay. I guess I was wondering what type of supplements people that would like hair growth can take to start the process to make it to help with their hair growth. I know I'm gonna toot a horn for you before you answer that. I have been taking this Women's Balance. It's called Nutrafol. Okay. It's a supplement, it says hair wellness from within. See that? Hair wellness from within. And at first I was a little apprehension, but I got a little bit more encouraged because in the top it says keep growing. And I've been taking the Nutrafol for about 6 months, and I have seen a difference in my hair. So, you take I know Dr. Dika mentioned to me Nutrafol, and I've been taking this. You're familiar with that, Dr. Dika? But I wanted you to mention to everyone that's listening, if you could maybe give them a special of some sort with the Nutrafol. If you could.
You working for the company? I'm just kidding.
Well, I know if you order from the company, these are like $88 a bottle. So it's a worthy investment, but like Michael said earlier, you invest in it. What you say? What's the saying?
I say you buy what, and beg for what you need. So we need to buy what we want and not beg for what we need.
Facts. So I bought it because I wanted to salvage my hair, and I'm noticing tremendous growth from everywhere. And I had thinning on the top. I'm having growth on the sides, and I'm just enjoying the natural me. So Dr. Dika, do you have, I'm sure you have this available, correct?
Yes, I have it in the office. Like you said, the one bottle, if you find you got it on Amazon or online or the website Nutrafol.com, is $88. If you buy a 3-month supply, so it's going to come with one bottle and then 2 other packets. Basically, when you're done with the bottle, you just dump the other one in there. So the 3 bottles, if you buy it online, I think it's $239, but if you subscribe, it's $209. So which is what I'm selling in the office, whether you subscribe or not. The 3-month supply for $209, so you're saving $55. Online, you have to use a doctor's link. So I have a link that, you click on the link, which is my page kind of thing on that website. That's how you get a discount online. But in the office, you don't need to sign up or anything. You just come and get it. It's at $209.
Dr. Dika, so how would the stylist, I'm sorry, stylist, you've been sitting so patient. Was there anything that you wanted to comment or ask Dr. Dika since she's on here? Anything you want to ask? Because I've been asking all the questions because I just want to know. I don't know if it's because I'm nosy or I want to know, because I want to know, why is everybody's hairline sliding back? What's going on? Their hairline is in the middle of their head. What is that? What's that all about? But okay.
A question for Dr. Dika. So if we refer our clients to you that have the inflammation, is that a forever thing as well, where they will constantly have to get the shots for their scalp?
Oh, thank you. So again, depending on what it is, right? If it's CCCA, usually, well, based on, clinical studies and case report, what people have done, usually we do that treatment regimen nonstop, right? For like 5 to 6 months. Because again, if you do only 2 months and you stop, you haven't really completely calmed down that inflammation, right? So usually I do every month for about 6 months. So while you're doing the shots, right, we also do the oral antibiotic if you can tolerate it. Some people can't tolerate it. And then we also do topical steroid. There's also another medication, Plaquenil or hydroxychloroquine, that sometimes we have patients take, but most of the time I don't have them do that. Sometimes after I'm done with the shots, like the 6 series or whatever, so I see them maybe 3 months later. But I tell them, the minute you feel like it's itching again, you don't want to wait too long, right? Come back. So sometimes they come back in 3 months, they still don't have symptoms, which is a good thing. Or some people go like a year or so without having anything, like all of a sudden it's starting to itch again, right? So you want to just, whenever it's itchy, you want to address it right away. And then hopefully maintain, right? Anytime you're stressed out, it can start acting up, because that's your immune system is connected to everything, your skin and everything.
During the treatments, what do you recommend as a stylist that we should do for our clients when it comes to styling? Because does the shots make the client's hair tender? Should we not be, especially if you're a natural stylist, you're going to do natural styles such as twist and braids, coils, even with the products, is heavy products going to prohibit that serum from really going deep into the scalp? So what are some recommendations you have for us?
So the shots go straight into I'm in the office. The shot go straight into the skin, right? So whatever you're doing on top is not really going to affect whether the shots work or not. But like we're saying, even though the hairstyle doesn't cause the disease, it can make it worse, right? So gentle hairstyle is always recommended. So you want to avoid straightening, you want to avoid, anything that's going to be pulling too much, the tight braids. And you always, you did my braids, so it's not tight, right? So you don't want anything where, and then the traction is also comes the same way, right? When it's tight, you get bumps. So you don't want anything that is too tight on this, braiding too tight. So just gentle. I feel like you guys know how to do it. So hopefully those patients that have those symptoms, they also have hairstyles that are kind of knowledgeable about it, right? So that's like, okay, she has these symptoms. I don't really want to do like the hot comb, or I don't want to, chemical straighten her hair this time. I'm going to give it a break. Or if you used to do your hair, relax your hair every 6 weeks, how about you stretch it out to every 8 to 10 weeks, right? Slowly you can transition.
Okay, thank you.
Yolanda, you have a question?
Yeah, I wanted to know, does the Nutrafil work for female pattern baldness?
The Nutrafol?
Yeah, that one. Yeah.
I can speak for myself. It's worked for me, and I'm repeating 25 over and over again. But it's worked for me for thinning hair, for sides, traction of alopecia. Just it's worked for me, and I've been using it for about 6 months.
Okay, but I'm asking the doctor.
Okay, doctor, could you address her?
Sorry, what was the question again?
She wanted to know, does the Nutrafol work for female pattern baldness?
Yes, yes. So basically, for what they have in there, they have different ingredients, right, that address not only the hormonal part of hair loss, the stress part of hair loss, the inflammatory part of hair loss, right? So actually here is one of the things that they sent me. So these are male pattern hair loss. So guys, take it too. This is female pattern hair loss, right? So basically, because if you have inflammation, it's not helping the inflammation like the treatment, the shot that you're getting, right? The reason why I have like Mrs. El that take it while she's getting the shot is so that whatever hair she has with those follicles that are still there, so that hair can grow thicker, right? Same to the female pattern hair loss and male pattern hair loss. The hair follicle is still there. The hair is very thin. So we want that hair to grow thicker and healthier.
Okay.
So this is what it does.
Okay. Thank you.
And usually they say at least 3 months, right? It's not something that's going to just work overnight. You have to give it time. Yeah.
Okay.
That's what
Okay, I'm sorry. Go ahead, Mike.
No, I was going to ask, like what is the time frame that the clients will start seeing the hair turn around? But she already answered. So,
well, I can speak it from a patient's perspective. And Melody, I have gotten the injections. I started getting them. I had a lot of perm in my hair and color, and Sherry is my stylist. And when I started, I was getting more baldness on the top of my head. So I actually found Dr. Dika, and I'm so glad I did. And she began giving me the injections. So I think I'm on my second, I'm getting ready to start a second round of injections, or I'm going to do
the first round.
I just finished the first round. So I'm going to probably do another round, or I'm going to do some other form, you know what she said, a PIP or something. So
yeah, she's gonna do the Keravive, which is the Hydra Facial device that has like the growth factor into it. So she's gonna do that. Maybe we should record it and show it to everybody.
Right.
Absolutely not.
Absolutely, yes.
No, well, we probably will, but could you explain what the procedure would be like? It's like a Hydra Facial for hair, you said?
So different treatment options, right? Also depending on the price, I mean not the price, but I guess everybody's budget, right? This one is a little bit cheaper than the PRP. You know, you get some improvement, not as well as the PRP, but you get some improvement. So basically what it is Hydra Facial, if you've ever seen Hydra Facial, it's this device. It's like a long thing like this that has, okay, here it is. Right, this is the piece of the Hydra Facial. So for the scalp, it's the same. There's a machine that's suction, right? So when you're doing a facial with this, you're kind of sliding this on the face and it's suctioning all the dirt, kind of cleaning, like deep cleansing your face. You do the same thing on the scalp. After, and then you have a bucket, right? There's water going through. You have a bucket that's kind of collecting all the dirt. And then after that, there's a serum that they attach to the end. The growth factor is attached there. Then you kind of put it in after you've kind of cleansed the scalp.
Okay.
Yeah.
That
so
sounds
this is
real exciting.
Monthly. You do monthly for 3 months.
Okay.
PRP is the same thing. We draw your blood. Yeah, go ahead, Mike.
Now, these steam conditioners, are they good?
Oh, the steam.
Yeah. That's what I want to know.
Steam conditioner.
Well, it's just like a.
You have to educate me here.
Okay, it's just like a dryer. They go to like they put different, like protein condition, regular conditioner, and they put you up on there and steam. It gets on the hair, okay, and they said it's supposed to help clean the scalp and all that. Is that good for the hair?
It's an old school thing. My mama.
Well, now they charging people like $250 for a steam, steam treatment with your style. You know what I'm saying?
Yeah.
I had the old Ulster's dryer with the steamer. We had that back in the 70s.
Yeah. distilled water. You know, you only can use, you know, distilled water.
Yeah.
You know,
Right.
to do treatment.
Right.
And
Hair up, put it in the dryer. Yeah. Steamer.
My best guess is when you hold on.
I would say the
So
texture.
so my best guess is that steam is gonna probably open up, right? It's
Right.
just like open up all the follicles and whatever, and then the product can go in. It's just
Okay.
like when you have fever back home, like you said, you boil like a pot of water, you put some herbs in there, and then you
Yeah.
probably put your
Hold your
head
head
under.
over.
Right. On your
So
face.
yeah, exactly.
Yeah.
So
Yeah.
Okay.
Mhm.
Melody, you were gonna say, what were you gonna say?
Oh no, I was just gonna say my experience with it. I love it, but it's not good for everybody. You know, just because something is a fad or it looks good, it always go back to your texture. It always go back to your porosity. I've used, you know, that type of treatment, and it can make someone's hair feel drier, then more moisturized. And then those that had got color or previously damaged hair, it seemed like it soaks it in better. So it just, for me, it just depends on the person, the porosity, and the texture of the hair and scalp.
Sherry, did you want to comment on that?
No, I made my comment about the old school steamer. So
Okay, and what do you guys mean by porosity?
oh Lord, porosity.
Oh,
Low porosity, balance, high porosity. A lot of people that has color, relaxer, naturally really dry texture. I'll say more the coily texture. They have more of the higher porosity, meaning that their hair is always open, you know, and it's hard to
right.
close. So you can put all the conditioner and product on the hair, or a lot of people think oil, and then within a few minutes to the next day, they're like, my hair still feels dry. Low porosity is when it's hard to get anything inside the hair. The hair it tend to look shiny. You put too much product on it, it'll look like, they always have lick cat, you know, very way down, you know. So that's my layman's term of porosity.
Right.
So what about taking care of your hair in the winter months? Because we live in Wisconsin and things are about to change. And as a matter of fact, this weekend or next week, I know I personally, and I know other people would like to know, what can you put on your hair? Because you can't wear the wool. What do you do to take care of your hair and keep it healthy? So if the stylist could comment, and then Dr. Dika help.
Well, I always say, you know, to my clients that want to use wool hats or whatever, I always say, you know, get a scarf. Get silk, and if you can put, you know, do like a lining inside of the wool cap, if that's what you want to wear, you know, you can do that, you know, to protect the hair from the wool. I always say, you know, do protein treatments, you know, use good protein and, you know, and conditioners and stuff like that to hydrate the hair. You know, I always use hydrated shampoo, conditioners, all that stuff to put, you know, back moisture into the hair. And that's pretty much, I mean, it's nothing pretty much else that you can do, you know, because it's already cold and dry. You know, our body already, you know, doing the flips, you know what I'm saying, with the dryness, you know what I'm saying? So that's what I pretty much tell my clients.
Okay, Sherry or Melody?
Sherry? Okay, well, I'll say I do more I do more protective styles. So a lot of times, more so now, my clients start going to more of the silk press. They go toward the protective styles like the crochet. So we try to talk, like, depending on their texture, I try to say, well, you could do this or do that, but more protective styles, making sure your ends are not just free. So a lot of times in the summer, a lot of clients wear coils, wash and goes. We kind of prevent that in the wintertime because you don't want your curls just to be out, because it's already hard for our hair, our natural oils, to kind of slide down our hair. So in the wintertime, it makes it even that much more harder to keep that moisture in. So protective styles for me.
And Sherry?
Just same thing. I mean, just keeping their hair moisturized at all time, a good deep conditioner, because it's hard, cold out here, you know, that pretty much. I mean, you know, like she said, the coils are out for the winter time. For the summertime, they're great. But just keeping it, I don't know, just pretty much keeping it moisturized. That's with me. Sorry.
Okay, Dr. Dika.
They're the experts. Why are you asking me? So what the thing is, they talked about moisturizing, right? Winter dry. I'm like, yeah, that's what I tell patients that have skin issues, right? In the winter is when most of people have their eczema flare-ups, you know, they're itchy all the time just because of the dryness. Same thing is for your hair and your scalp, right? You're dry on your skin, on your body, you're also dry there. So I agree with moisturizing. Just make sure that, you know, deep conditioner and things like that. So I agree.
And we talk so much about hair and healthy hair that we didn't even get a chance to address skin.
I know, I take care of the skin too.
So just if you could just mention, because we are going to wrap things up. We were hoping that Chandra could come on, but she wasn't able to join us just yet. But Dr. Dika, if you could mention a few skin conditions that African Americans might have and how to take care of them. So I'm thinking of acne. That's the number one thing I'm thinking of.
Yeah. And the thing with acne is everybody gets acne, right? But for us, with acne comes acne scarring and hyperpigmentation or dark spots, right? So when a Caucasian patient of mine has acne and the acne clears up, the skin looks great. For us, even if they were picking at it, right? Because picking is the issue. But for us, when we pick at it or when we want to pop it, right? That inflammation leads to the pigment or the melanin leaking under your skin, and you have the dark spots. So if you have acne, you want to get it treated. Just like hair loss, acne is a medical condition, right? That we treat with not only prescription, so topical, sometimes we also do oral medication. Or antibiotic, when it's really severe, we do treatment like Accutane to help clear the acne from the inside out, kind of thing. For the treatment of the hyperpigmentation or the scarring, we have a lot of options. So we do chemical peel. Even when you have acne, we can do chemical peel as well. Just removing slowly, like every 2 weeks to 1 month, removing that layer of your skin. You know, over time, usually your acne kind of gets better and the pigment or the discoloration goes away. Anytime you have, everybody should wear sunscreen, but anytime you have inflammation, if it's not protected against the sun, it's going to lead to the dark spots, right? So I tell people I wear sunscreen every day, right? I didn't used to, but I know, you know, the benefit of sunscreen. It's true that we don't get skin cancer, but we get a lot of effect from the sun, right? There's another skin condition called melasma, more common in patients of color, so meaning Black, Hispanic, Asian, where you get like the dark spot here, sometimes here, sometimes here. Yes, so that one is the triggers are you have the sun, the hormones. So those people, it's like before you spend money buying the product and doing the chemical peel or microneedling, make sure you wear your sunscreen.
Okay, and what about people have eczema? You know, could you mention that? Because I know
that's also a big thing in this, you know, Black people or Black community. My niece has really bad eczema. So again, these are the months, right? October, November, December, like the fall and winter when eczema is really, really bad. So humidity, low humidity in the summer, fall and winter. So you want to make sure that you have a humidifier at home. Moisturize, right? So I usually don't use the term lotion in my practice because when I say lotion, people are gonna go get like a big, you know, thing, a pump bottle kind of thing. When you have dry skin or eczema, you want to avoid those things. You want to avoid anything that has scent. So those lotion have not only preservative, but also have alcohol. So when you put it on your skin, it dries up right away, right? And sometimes it burns if you have cracks. So I usually say, I prefer you use a cream or ointment, right? So usually we have to work together because I don't want to tell you to use petroleum jelly or Vaseline, but you don't want to use it, then you end up not using anything. So we have to figure out what you're going to like that is going to help with your skin. So I want to recommend something that is reasonable for you to use. And I always tell people when eczema is really bad, you need a prescription. So prescription is like a topical steroid that you use. You don't use it every day. You can use it every day when it's really bad, but moisturizer is every day, regardless of whether you're itchy or not. You want to moisturize. You can take a shower, but as soon as you get out of the shower, you want to apply the moisturizer.
Right.
You don't want to take hot showers, right? Because that
Right.
heat is going to strip your oils, right? You don't want to scrub your skin too much, right? You just wash the areas that are dirty, right? You're going to use the washcloth, whatever, in your armpits, the groin area, your fingers, your feet, kind of thing. Everything else, you can just use your hands, kind of thing. Okay. So those are things that I recommend to my patients. Anytime you feel like your skin is dry, put something on, even if you have to do it 10 times a day, right? Don't just say, okay, I took a shower, put lotion on in the morning, but I'm dry. Well, you haven't really applied. Your skin is not like everybody else's skin. Eczema skin, right? The skin it's like a gate, right? Preventing or protecting your body. So people that have eczema, they have holes. So basically the water in the skin is coming out. Normal skin usually doesn't let water out. People with eczema, the water comes out. So when we moisturize, we put a little bit in, but the main reason we moisturize, we want to prevent the water from evaporating. So that's why we want something a little bit thicker than just, lotion. That's, one of the reasons.
So Vaseline, you know how
Petroleum
we
jelly. I'm not saying you should buy the brand Vaseline, right? Go to Walmart and buy the equate brand of petroleum jelly. It's like $2 or $3, right?
Yeah.
That's all you need. If you go Vaseline, it's gonna be like $9. So petroleum jelly.
Yeah.
I always say the
you
thicker, the better.
Our parents greased us up real good.
Dude,
That's
I'm
good. Yeah.
lotion and Vaseline, honey.
But Dr. Dika, do you believe in skin bleaching and all that stuff? Is that good for the skin?
Skin bleaching?
Yeah.
Well,
people do. I mean, people do that. One of my clients asked me, to ask the question. And I was like, I'm going to ask it, but.
So you going in, huh?
Oh, so wait a minute. Can I ask you, Mike? Is it like the cream, the old school cream, the fading cream? Is that what you're talking about?
You talking about the black and white? They call it black and
Ammonia cream.
Yeah.
Well, that's what I told her. I said, well, back in the day they used to do that, and I didn't know did it work, but they did it. So I wanted to ask you, do you believe that? Do you, I mean, yeah, I need to know. So I can give her.
So the thing is, when you buy something over the counter, right, it's not regulated. You don't know what's in it, right? So when people have what I talk about hyperpigmentation or melasma, we do give them bleaching cream, right? The active ingredient is called hydroquinone.
Okay.
If you know the brand Ambi, right, lightening cream, or even Palmer's has a brightening cream, it's a 2% hydroquinone. 2% is okay to have over the counter, right? Anything higher than that is not. But if you go to some stores, you'll see 10, 12%. I don't know how they get it there. The thing with that is because it's not regulated, because it's not prescribed, they misuse it. They overuse it. Overusing hydroquinone can cause darkening. Right?
Oh.
Yeah. So if you overuse it, then you've seen people, right, where they have like it's dark here, it's dark here.
Exactly.
Because they use the strongest one, right, that nobody will prescribe in the United States, but they find a way to get it, or they get it from, Africa or Asia or something like that, and they end up with darker spot because they overused it, right?
Wow.
So, but yeah, we do prescribe hydroquinone to lighten spot when you have scarring or dark spot or hyperpigmentation. But we always tell patients, usually we have them use it for a certain period of time and take a break, right? Sometimes we say two months or 3 months, and then you have to take a break.
Okay.
Because overusing it over time, you can actually make things worse.
Okay.
Yeah.
So with most African Americans or anyone actually having issues with acne, I know you recommended something to me, and I just wanted you to mention the active ingredient. I know you mentioned the CeraVe, the acne foaming cleanser. I would not have known about this if Dr. Dika had not given me a sample. So there are so many perks.
Yes. Yeah. So for acne, so there's bacteria, a little bit of bacteria from the inside, right? That's one of the causes of acne. Depending on how old you are, for teenagers, the hormone causes the hair follicle, not the sweat gland, not the oil gland to kind of get bigger, right? We have bacteria and the bacteria loves oil. So then you have more bacteria and then more inflammation. Benzoyl peroxide is the active ingredient.
Oh yeah, it says 4% benzoyl peroxide.
Yeah, so benzoyl peroxide is an antimicrobial. It's an antimicrobial medication that helps for inflammation. So when you have the red bumps, right, the acne and bacteria on your skin, the good thing with that, it doesn't give you the side effect, long-term side effect of oral antibiotic or antibiotic, right? The longer you're on antibiotic, then your body can get used to it. Then if you get sick, you need it, it doesn't work, right? Benzoyl peroxide is safe in that sense. The different strength, it starts from 2.5% to 10%, right? So if your skin is sensitive, you don't want to get the 10%. You can start with the 2.5%. It's over the counter.
Okay, and I'm going to mention something else too that you hooked me to, and now I'm seeing commercials for it, but I'm ahead of the game. This La Roche-Posay,
Okay.
and it's a gentle foam and moisturizing wash. You see, it's halfway gone.
Yeah, La
but it's
Roche-Posay is a
amazing.
nice brand. I like their product. They have the benzoyl peroxide as well, the 5%. They have nice cleanser. They have good moisturizer. And then I wanted to say also over the counter for acne, right? Before you see a doctor, if you feel like my acne is not too bad to go see a doctor, do that benzoyl peroxide, which helps with inflammation, the red bumps. And sometimes you can use it as a spot treatment, right? You put it on the inflamed bumps. And then there's another one called adapalene. And then there's a brand called Different, which has adapalene 0.1% gel. Adapalene is a type of retinoid, right? So it helps with the blackheads and whiteheads. So that's something that I have people use over the counter. You can use the prescription also at night. You wash your face and then you wait about 5 minutes for the skin to dry, put it on. And one thing with that, it can dry your skin. So in the winter, if you use it, sometimes people use it and then they call like, oh my God, now I'm breaking out. I'm like, no, this medication just can cause dryness. Dryness causes irritation, almost like a dermatitis, right? So if that happens, just put it on and put a moisturizer on after that.
So you're saying, with the winter months coming, use your sunscreen and then put a moisturizer on top of that?
Always use your sunscreen, right? Well, I guess if there's no sun, you shouldn't. But what we've noticed also is that even with the computer, the blue light, the glare from the computer, it can affect your skin, right? So if you're somebody who's always working in front of the computer, and then you have the dark spot, you have melasma, right? Wear your sunscreen. But yeah, and then in winter, moisturize. Don't take hot showers. Use a humidifier.
I don't know. Now you poking, Doc. Now you poking. We love a hot shower.
You don't want to dry out your skin like
Right.
your scalp.
No. I think I have thoroughly enjoyed having this conversation with you, with all of the stylists, for all the guests that joined us, and even those that couldn't. Be sure to watch and reach out for Dr. Dika. I have her card, but Dr. Dika, could you give the website where they can reach you? Okay, I'm gonna somehow you muted. I'm sorry.
All right. Okay. Sorry. Yes, my website is www.m as in Mary, Dika, Dika, dermatology.com. And on the website, you can actually find the phone number and you can schedule appointments online. Otherwise, we are in Burlington. So it's on Milwaukee Avenue, which is the main street here in Burlington. And it's right across from Advanced Auto Part.
So you guys are located in the bank. So for those of you that are trying to get to Burlington, it's real easy. You just take Highway 100. You're going to end up on Highway 100. You know where the Walmart is? I know y'all know. You go on Highway 100 south through Hell's Corners, and then you're going to come around a bend. Or you can go on Loomis Road. If you stay on Loomis Road, Burlington is about 20 miles from here. And it really doesn't take that long because there's not many lights on the highway strip that you're taking. So I would say even on a bad day, it may take you 35, 40 minutes. But from the Chicago area, if you wanted to drive up, it's maybe about an hour, a little over an hour, but it's worth it. I'm telling you guys, for the investment, just to have the care of an African, for real African, but African American dermatologist. And I know, Dr. Dika, they want to know because you have an accent. Where are you from?
I'm originally from Cameroon.
So
Cameroon
she's
is this
from,
country in Africa.
so she is African, but because she's here with us, an African American and a specialist in not only the hair and the skin. Now, this is our first session on hair loss and skin. We really didn't get a chance to tap into a lot of the skin issues that a lot of us may be having, but we will be on again. We're going to have another episode coming up, but I encourage you to go on to mdikadermatology.com and schedule your appointment. And I am sure that Dr. Dika may even, during this time of COVID, schedule a virtual appointment. So if you schedule an appointment, just put additional notes to say that you'd like to meet with her virtually. I know that she would prefer to see you in person, but if the situation is such that you're not able to see her in person, I'm sure she's going to want to talk to you virtually and with the camera on. And Dr. Dika, I know you can't prescribe things if you haven't seen the patient, but there are some things you can recommend.
I can recommend it, but for hair loss, it's good to examine it, right? Touch, feel the scalp and see what's going on. So we can always do the virtual, but before we say, hey, this is what it is, I feel like I have to see you and kind of examine the skin.
Right.
Yeah, otherwise, non-prescription stuff that we already discussed, right? If your scalp is itchy, you think you have dandruff, there's shampoos that you can use to help with the dandruff. I know the shampoos that are out there are a little bit drying to our hair. So if your hairstyle doesn't have a nice shampoo, we have shampoos here. I have a shampoo that another colleague of mine in Maryland has been using for years, right? And she has 90% of her patients are African Americans, and they love that shampoo. So it's different from the shampoo that we prescribe. It's not as drying to the hair.
And even if they can't get the shampoo, they could connect with a natural stylist or someone that's helping them within the transition from going from the traction on the hair or the color or the perms
to natural.
Exactly, to natural. So I'm going to ask the stylist again to just mention how.
Sherry wants to say something.
Okay, Sherry, go ahead. And then you guys mention after that, how can clients get in contact with you? Okay, Sherry, go ahead.
I was hearing this word natural being kicked around. I don't know if
Come
you
on.
remember what I said before.
Uh-oh, come on, come through.
Natural. Everybody is natural, y'all. We all natural. The hair that come out your scalp, that's natural. The only thing that changes about it is if you add a relaxer, color, or whatever. But everybody hair is natural. I learned that from Tommy Arnaz. So I felt that way all the time. That everybody here is always natural. When we say we're natural stylists, what I'm saying is I'm working with your hair, period. I'm just working with your natural born, giving hair out your head. That's what I'm doing. I might throw a little track in there every now and again, but.
Now, how can clients get in contact with you, Sherry?
They can reach me on Facebook. I'm regular Sherry Douglas, the one with the hat, because I know I have 2 Facebook pages, but I have one with a hat. My Instagram is Sherry_hair chemistry on Instagram, and my phone number is attached to that. Don't call me with no foolishness. I'm just telling you right now. I'm professional. Don't start nothing. I'm all about the business. Okay,
Mike.
Well, you can reach me at on my Facebook page, which that's MICA Hurst HURST. You can inbox me and we can go forward from there as far as on.
Okay, Melody.
I have a Facebook page, Amani Natural. On there, you can definitely book a consultation. I'm not going to give out my number because it's hard. But anyway, yes, you can go on my website and book with me. And then also I'm on Instagram and TikTok as well. and I go live. So if you want to know more about my salon and the products and everything like that, follow me on TikTok. I do a lot on there.
So you guys have a lot of options to consider. And I'm just gonna piggyback with Sherry. Don't come with foolishness. You can't come to the stylist and ask if they could do a miracle for $20. Investing in my preaching. Y'all better say
Yes,
amen.
you are. Amen. Amen.
You invest in yourself and you treat yourself by taking good care of yourself. And it may start from the inside out. So Dr. Dika, it may start with you by helping to get rid of the inflammation or the itching or the burning or the heat, or helping them to understand how to care for their hair. But it can always be maintained with the right stylist. I'm so thankful you guys were able to join us this evening. Stay tuned for our next session. And feel free to reach out to Dr. Dika. Can they reach you on the website or on your Facebook page?
On the website, yes, on the Facebook page or Instagram. And I think both of them are Dika Dermatology, so Facebook and Instagram. Yeah, they can ask questions. They can call the office. They can text the office number as well.
The office number is 433, I'm sorry, area code 414-433-7692. So if you have any questions, or if you just want to, check in, I would encourage you to schedule an appointment, because it is going to change your life. Okay. Thank you so much for joining us this evening. Please don't hesitate to reach out and stay tuned for our next episode. Good night, everyone.
Thank you. Good night.
Good night.
Bye.
Bye.
We did it.
Stop recording now.
Oh.